At Back to Normal, we take a thorough, hands-on approach to assess your body's structure, movement, and any tightness in your soft tissues or joints. We carefully observe and feel imbalances in posture, unusual tissue textures, and limited range of motion. Then, we choose the most effective manual technique to help you get the best results. So what exactly is manual therapy? Manual therapy is a hands-on approach used by physical therapists and involves skilled techniques where the therapist moves or manipulates the patient's body to address issues in the muscles, joints, and other soft tissues. Manual therapy is particularly useful to help release tight muscles or restricted joints that are limiting mobility, flexibility, or causing pain. There are many techniques that manual physical therapists use, such as joint mobilization, soft tissue massage, myofascial release, and muscle energy techniques, among others. We often combine these methods with exercises, education, and neuromuscular training to help you improve your overall function and well-being. Two common and effective manual techniques are joint mobilization and muscle energy techniques. Joint mobilization is a hands-on therapy that involves gently moving your joints at different speeds and pressures. This approach directly targets the joint, helping to relax tight muscles, relieve pain, improve circulation, and reduce spasms by disrupting faulty nerve signals from the spine. It can also free up trapped joint tissues and even boost muscle activity in the treated area. Joints aren't just connections between bones. They're filled with sensors that send signals about body position and pain to the brain. When a joint swells, these signals get weaker, and the muscles attached to that joint don't work as well, often causing them to become too tight or weak. That's why physical therapists often treat the joint first before focusing on the muscles or prescribing exercises, as the joint is often the source of movement restrictions and proper lack of muscle firing. Muscle energy technique is a hands-on therapy where a physical therapist helps a joint move by gently contracting and stretching the muscles around it. Our nervous system controls muscle tone, and this method helps reset the muscle's resting length or activation in and around the spine, arms, and legs. Muscle energy often requires the therapist to get close to the patient so that they can properly control the restorative motion. The therapist will then position the patient gradually into the range they want the patient to attain, hold them there, and then have the patient contract certain muscle groups against the therapist's opposing forces. As the patient relaxes their muscle contraction, the therapist will move them slightly further into the new range they gain. This method is very gentle, yet powerful, to quickly restore overall joint mobility, reduce swelling, help reactivate and stretch tight muscles.